Yes, good evening. Chronic cerebrospinal venous insufficiency is a syndrome characterized by flow blockages of the internal jugular and the avigos venous system with insufficient drainage from the brain. This syndrome has been recently inserted in guidelines in a consensus conference and published in the issue of December of the organ of the International Union of Vascular Medicine and Angiology, International Angiology. Venous pressure in the blocked internal jugular vein and the avigos vein was found significantly higher. There are many other people who observed this kind of syndrome and correlate and associate the association of this CCSVI with a neurodegenerative disorder called multiple sclerosis. We described an original group of patients in which we found a very strong association, 100% people, and in our experience we found an association of 90%. Dr. Zibadinov in the United States described an association of 60% and the presence of CCSVI also in other neurological disorders and in normal controls in 22%. A group from Jordan described a prevalence of MS of 84% versus 0% in controls, and Dr. Simpa, who actually is hearing us, found an MS prevalence of CCSVI in 90% of cases. So this practically means that CCSVI was found associated to multiple sclerosis practically at different latitudes and in population with different genetic background. I found gold standard venography, catheter venography, may depict very well CCSVI, which is characterized by narrowing, valve malformation with bypass activated through collateral circle. I described this in the slide presentation sent 2 days ago. As far as the diagnosis is concerned, catheter venography is certainly the gold standard, but unfortunately is an invasive technique. We developed an echo color Doppler protocol, and I believe that color Doppler is an ideal tool because it's not invasive and it's very useful for screening. We also performed some tests in order to understand the reproducibility of this color Doppler protocol, and we found very useful that the physician or the technician, the sonographer, is very useful that are trained with some significant difference in between trained and not trained operators. As far as the treatment is concerned, we applied simple conservative angioplasty, and we described the effect of this treatment in a pilot open label prospective study.
Dr. Zamboni?
Last December.
Dr. Zamboni?
Yeah?
Sorry, could we ask you to suspend for a minute? We're working on interpretation. They're struggling at the moment. Away from the... Dr. Zamboni, can we ask you to take the paper
Yes.
away from the mic, please? Could you take Could you take the papers away from the mic? That seems to be causing some of the difficulty, please.
Okay. We described the CCSVI treatment by the means of standard balloon angioplasty in a paper published on the Journal of Vascular Surgery last December. According to our results, angioplasty demonstrated to be safe, and we never had major vascular complication, and the patients were discharged from the hospital in the same day, in the early afternoon. I sent to the member of the committee some pictures showing the technique, but this is not really an experimental technique, but is a well-known technique simply applied to a new venous segment in which previously this kind of malformation were not described. We followed up our patients for 18 months mean, and we found a significant reduction in the number of relapses of multiple sclerosis in these patients by comparing what happened in the previous 2 years. We also found a significant reduction of the so-called active lesion measured by blinded MRI. We also measured significantly an improvement in relapsing remitting multiple sclerosis patients for cognitive and motor function. And very important, we also found a significant decrease of chronic fatigue. Chronic fatigue is one of the more disabling symptoms in people affected by multiple sclerosis. Until now, this specific symptom is completely orphan of any effective treatment.
Dr. Zamboni, could I ask you to wrap up, please?
Ask to? I repeat this. Chronic fatigue is one of the more disabling symptoms in multiple sclerosis. And following balloon angioplasty, we found significant improvement of this symptom. This is particularly interesting because till now, there are not effective treatment on chronic fatigue. And chronic fatigue is really disabling for multiple sclerosis patients and completely orphan of any effective treatment to date. It is clear that more study is needed, but treatment must not wait for clinical trials. Actually, in Italy, we are starting for randomized control trials, but I think that this kind of treatment is completely proposable under the umbrella of ethical committee, measuring what exactly happened in the follow-up of patients who undergo this treatment.